including the need to wear face masks. Hooray is what I say. And yet, big retailers like Sainsbury's, John Lewis and Waitrose will continue to ask their customers in England to wear masks in their shops when Plan B rules end tomorrow morning. Well, I just think this is outrageous. I mean, how many more years are we going to go on living like this? Have I got this wrong? Medically, have I got this wrong? Well, joining me to discuss this is Dr. David Nichols from Doctors Association UK, who is a consultant neurologist. So, David, tell me, I mean, I felt tomorrow was a liberation. We could go to the shops and we didn't need to wear those horrid face masks and we could sort of almost feel life had gone back to normal. But you think Sainsbury's are right, do you?
I do, and that's because I'm afraid this was a political decision. It certainly wasn't based on any public health evidence. There's lots of evidence from other countries. If you look at what happens in Asia, South Korea, and they've avoided a lot of the lockdown side of things in South Korea, is by good use of face masks. And I would say wear the right size mask. And you know, I'm afraid our health policy is driven by more about keeping the right wing of the Tory party happy.
Well, I mean, there is a question of liberty, there is a question of choice. I mean, what interests me about this face mask debate, is early on in the pandemic, Van Tam was saying there is no evidence that the general wearing a face mask for the public will affect the spread of the disease. So to begin with, we were told by the experts who were getting up and doing those daily 5 o'clock briefings, the experts told us face masks made no difference. And now we're hearing from experts that they do. I mean, who's right here?
But that's because the knowledge is clear that COVID is airborne, and there's a lot of things we could be doing, and that's the problem we're seeing now with cases, particularly higher in younger people, is we've failed to deal with ventilation in schools. I think it's been a mistake and that we haven't thought about masks in schools, and also think about the quality of masks is important. So, I mean, Doctors Association have campaigned since the beginning that healthcare professionals have decent-sized PPE, and it's only just this month they've changed the policy for these FFP3 masks. And, if I was out and about in the supermarket, I would be wearing an FFP2 mask. It is hardly a human rights violation to wear a mask when you're doing a weekly shop. But yet, that's, if you look at the Desmond Swains of this world, they say they're, genetically immune from wearing a mask, which is just ridiculous.
But David, what if COVID lasts and comes back every winter for the next 2, 3, 4, 5, 6, 8, 10 years? Are we to go on as a society that perhaps for 10 years or more has to wear face masks when we go to do the weekly shop? Is that really what we're saying?
Well, COVID doesn't get bored, okay? You might get bored, but COVID does not, okay? And, we know there's, 4 million people aren't vaccinated. And actually, this is about doing the right thing as a community. Just tonight, I was actually speaking to a patient of mine I've known for 20 years who has a very severe form of neuropathy, works as a teacher, okay? So she's clinically vulnerable. When you go out to the shops and wear a mask, you're helping to protect people like her. And actually, I think there should be a case of good manners, actually, that people are wearing a mask. And
so really what you're saying is that COVID-19 is going to fundamentally change the way we live for many, many years to come.
For the moment, that's not just me saying that. I mean, the World Health Organization was saying this on Sunday. And I think it's really important that broadcasters like yourself are responsible on this. Not just with masks. I mean, I've had arguments with presenters where they describe it as a muzzle. It's really not helpful. And it even relates to the vaccine debate as well. I've had similar arguments, and I've actually reported GB News, not your show, different show, for spreading health misinformation to Ofcom.
David, I don't want to wear a mask, and if I go into Waitrose at the weekend, I really don't want to wear a mask. If they insist, I will wear a mask rather than storm out in protest. But look, I make sure that the viewers get both sides of an argument, and I did introduce you by saying that, perhaps medically, you would tell me that I was wrong. But I will ask you this question. I will ask you this. The bombardment we're under to get the booster is quite extraordinary. Letters, phone calls, public advertising campaigns, and yet there's still a very large minority have chosen not to have the booster. And here's why. Because they know that having the booster, you can still catch COVID-19 and you can still spread COVID-19. And isn't it perhaps the moment at which we treat those that have chosen not to have the booster or not to have the vaccination with a little bit more respect?
And that exactly is why we need to do all of this. It isn't just about vaccine. It isn't just about masks.
Okay.
It's doing all of it. And, you know, I would urge, when you see people like, you know, the Steve James of this world, you know, when there's 1.2 million people in the NHS, you will get some cranks, okay? So for someone like that to say there isn't enough science about vaccines, yet at the same time promotes, and I kid you not, vaginal steaming, okay? For which there is no science.
It's too early in the evening. It's too early in the evening for all that. But David, seriously, you're not calling up to 100,000 medical professionals cranks, are you?
Well, no, not at all. And the problem is when that gets broadcast, okay, that sort of stuff goes viral on social media. I've done a lot of work with vaccine hesitant staff, and those kind of debates never come up. What does come up is the kind of debate about natural immunity, that kind of argument. And that's actually pretty easy to deal with, is that not everyone generates an antibody response. Safest way to get immunity is to get vaccinated. So, you know, maybe we should have you, Nigel, leading a campaign to get people vaccinated.
David, I respect the right of those who choose not to, and if they're taking risks with their own health, then so be it. There are many other personal choices that affect health. But what I don't want, David, is to live in a country where those who choose not to get a medical treatment are discriminated against. Almost a new form of medical apartheid. And that's the one thing I feel strongly about. But look, I will always, David, allow you and others to come on the show and make your argument, of course.
I'm a Liberal Democrat. I agree.
Very good. Thank you very much indeed for joining us this evening. Right, well, there you are. Some very, very strong views there.